When it comes to treatment for anterior instability, it kind of fits into a couple of different phases. So there's this whole Watson's protocol that has like 6 stages of where do you start. With the first stage really just being regaining scapular steadying phase. So they have them work on just trying to posterior tilt, kind of retract their scapula, doing exercise with the arm by the side. So that's kind of like phase 1. Is that right? It kind of progresses through these phases as range of motion becomes pain-free to then strengthening in much higher levels. And that's kind of what we'll show you here. Now if we stick this around the scapula, so this kind of gives him that cue for scapular setting. And then go ahead and hold that. Right? And it can start at like 45 degrees of abduction, and he's working on external rotation. Right? Good. And then it can progress to 90 degrees. Right? Again, he's working on external rotation, and you're making sure he keeps that scap setting phase. Good. Right. Another common one you think is the further they go into horizontal abduction, that puts strain on the anterior capsule. So we want them to then work on that. Right. So hold the scap, and you're going to go to horizontal abduction. Good. Nice. So those are 2 exercises in the higher levels, higher stages for anterior instability. All right. Another great exercise to work on it would be working on the motor control aspect, which can be done on the table. So go ahead and lie on your back. Right. And this can be done in supine and in prone. Right. At 90 degrees, right, he's working on just externally rotating and internally rotating at 90 degrees, trying to make sure that his humeral head kind of spins along an axis in that glenoid. Right. What we don't want to see is as he comes into internal rotation, this kind of pops up, or as he goes into external rotation, you see a drop of the elbow down towards the floor. Right? So these aren't necessarily a strengthening exercise at first, it's really just a motor control exercise at these apprehension positions. Right? The progression would be from supine to then prone. So if you go ahead and flip on your stomach there. So in prone, he now has to externally rotate against gravity, as well as he doesn't have the feedback of the table on his scapula. So we want to encourage that scap setting phase, and he's going to work on external rotation. This can easily be progressed by just having him add, a yellow TheraBand or a 1-pound weight. You don't want to add a lot of weight because really it's a motor control exercise that can become a strengthening exercise, but you don't want to overpower it, make it too hard where you lose the motor control aspect. Okay, so we've gone through making sure that they have a scap setting phase. We've gone through they get their range back, some higher level strengthening up at 90 degrees, some good motor control at 90 degrees. If he's a sports patient, we want to get back to sports, we want to kind of load that. So there's some norms. The one test that comes to mind would be the closed kinetic chain upper extremity test. So if Mike goes into like a push-up on that table, and we'll do it on the table here, right? Your hands would be 3 feet apart, 36 inches apart in a push-up position, right? And this is a time test, right? And what he does is he's going to take one hand, tap it to the other hand, right? And then back, and you're timing that for 15 seconds, right? For males, you're looking for about 20 to 21 reps in 15 seconds to be able to return to sport safely, right? This is a nice test. You go to relax it. It's a nice test to do early on to see what they look like in the first stage of sport, and then you can actually use it as training, having them load their scapula, good motor control, and use it as a training tool, not necessarily just as a test. All right, I know we went over a lot. Hopefully you guys enjoyed. You learned something from it. Take a look at our web app, PhysioU, for more tests and stuff related to anterior instability and labral tears. Take care, guys.